Welcome, everyone. Thank you for joining us today for our webinar on staying connected during the time of COVID. Today, we're joined by some great experts who have a wealth of knowledge in caregiving and technology. There will be a Q&A session at the end, so we ask that you please write in your questions in the Q&A box at the bottom of your screen, along with any tips or strategies that have helped you and your loved one. And with that, I'll hand it over to our presenters so they can introduce themselves.
Hi, everyone. My name is Andrew Philipoff. I'm a Senior Systems Administrator at the UCSF Memory and Aging Center. And I manage a large network of servers, however, I also work in other fields, technology-related fields, desktop support and cloud support, and I also have a little bit of knowledge in this particular discussion. My father suffered from Alzheimer's and unfortunately passed away over the summer, but I learned a lot how to support him and his technology needs. So perhaps I can share some of that with you today. Thank you.
Hi, everybody. This is Richard Caro, and I'm the founder of Tech Enhanced Life, which is both a website with lots of information about the intersection of technology and aging, and a community of older adults called the Longevity Explorers that like to try out new products and new ideas. And so my remarks today will be in the context of what we've learned about the intersection of technology and aging as it applies to sheltering in place.
Hi, my name is Matthew Ong. I'm a family caregiver, and my wife and I, we've been taking care of our mother for over 7 years now. She's currently staying at a nursing home.
So I guess we can just kind of jump in, Sarah?
Yeah, go for it.
Okay, so we're just going to go over some general technology tips. A few, considerations that you should have regarding, computers, particularly if you're, if these systems are meant for, the elderly, and some of the risks are, malware and them, people getting scammed financially, identity theft and privacy breaches. Some of the best practices, as you see on the screen, are, obviously use strong passwords, and you can use what's called two-factor authentication. In other words, use another device as a secondary password. Make sure your operating systems and your apps are up to date, and this goes for not just smartphones but tablets, desktop computers, laptops as well. Back up your data, or use cloud storage. Make sure that your data is safe and replicated somewhere else. And of course, the people that are, doing these scams and identity theft, they're going to want you to click on links and malicious emails that they send. So think twice about what you're clicking on and what you're responding to. It could save you a lot of trouble in the future. Regarding, computer support, I mean, if you're setting up a computer for somebody who is cognitively impaired, and I have some experience in this. I set this up for my father. Make sure that you set them up with just a standard login account and not one that has administrative privileges, not one that can install things or change things. Consider making that account auto login, in other words, without a password, because of course, cognitively impaired folks are probably going to have trouble remembering passwords. Simplify the computer as much as possible. Kind of, don't have all kinds of icons on their desktop, and just kind of make it just a little kind of neater and tidier for them and less, visually distracting. And like I said in the previous slide, make sure that you enable, all the application and operating system updates. Make sure that the system has, and when I say system, I mean, anything from a smartphone and up, that it has anti-malware software, and that the firewall is enabled. A firewall, and this, I'm sorry, does not apply to smartphones, but it's a piece of software that helps prevent your machine from being attacked from external sources, from hackers getting into your computer. And consider using OpenDNS to block inappropriate websites. I discovered this with my father. He liked to frequent inappropriate websites, let's put it that way. And so I was asked to help bring in a solution for that. And basically what OpenDNS and other similar services provide are filtering, so that if they type in some nefarious web page URL, they're not going to get to it. And they'll just get an error message. It works rather well. And as an advanced tip, one thing I did was prior to handing off my the laptop to my father, I actually made a duplicate of the hard drive, so that in the event that he corrupted it, and he did several times, you could just slide in another hard drive and just move on. And I realize it's rather advanced, but it's something that you could consider. Another way to, manage your privacy and your safety is to use password managers, and think of them as like a password vault. It's a place where all of your passwords can be stored, and kind of one password rules them all type of thing. And of course, this is done in a secure manner so that your passwords will be safe. There's several options, many actually, but these are the ones that I kind of know about, and they work rather well. And most actually have free or low-cost options. And then we're going to talk a little bit now about remote connection options. And I'll let Richard take over here.
Thanks, Andrew. So I'm going to try and do a couple of things, but I'm guessing that there's quite a broad range of different people on the call, and some of you might have specific questions. So I'm not going to try and just answer everything right now by talking, but I'd love it if you'd add some questions as we're going along. I guess there's a Q&A section at the bottom that you can type in. And what I wanted to start with talking about a bit is what I've noticed with our community of longevity explorers, who are people in their 70s, 80s, and 90s, and what they're missing most right now. And what they're missing most is kind of human interaction. There's lots of other things, of course, but that's really a key aspect. And I think that's what today's about. What we've really found is that, these kind of video interactions like we're doing today are suddenly coming into their own. Business people and young techie types have been using video interactions like this for a while, but we found in the past that, some of our explorers liked it, but lots of them really couldn't be bothered trying. They weren't motivated. And what we're finding now is they're very motivated. And so we're seeing people start using video interactions to talk to their children or to their parents. We're seeing people start to have their various social groups like book clubs, ukulele clubs, all sorts of other things, yoga, start to go online virtually. And the sort of questions we get are, okay, well, if I'm just starting out doing that, what should I use? Could I have the next slide, please, Andrew? So the truth is there's many, many different ways you can connect with video. And rather than give you a long list of all the things you could do, we've decided that it's most useful to make some very specific recommendations, which doesn't mean there aren't other ways that are good too, but these are the things we recommend. There's 3 of them, and I'm going to tell you about each of them briefly, but a good way to think about it is each one is good for different types of people. I'm also going to add a resource in the chat section that you can look at later on, where some of this is written down. So I just put that in there, but you don't need to look at it right now. Anyway, so the 3 things that we like to recommend are represented by these 3 icons. And so starting from the left, there's something called FaceTime, which is an Apple product. In the middle, there's something called Zoom, which is what we're using today. And on the right is a product called the Amazon Echo Show. And we like all of them, but for different people. And so I'm going to explain the differences. Starting with FaceTime, it's a really good way to have a one-on-one interaction with somebody, so long as both people are in the Apple ecosystem. In other words, you have an Apple laptop, as does the, or a smartphone, an iPhone, or an iPad, and people at both ends need to have those products. And if you do, it's very easy to use and it works really well, especially for one-on-one things. I'm not so sure it's quite as good for group interactions, but its big limitation is you have to be in the Apple world. And it's really best for one-on-one, even though it does have a group feature. As these things go, it's pretty simple, but we have found that there's a category of person, especially if they have some kind of forgetfulness or cognition issues, it's too hard for, and we'll get to what the answer is for them. Before we do though, in the middle is Zoom, which we're using today, and we think it's fantastic, especially for group interactions. Our explorers, who aren't by any means all tech savvy, have started having their face-to-face meetings now happen online with Zoom. And whereas today we're doing a sort of lecture, one of the powers of Zoom is that it lets you have a multi-person interaction where you can see a whole grid of different people in video simultaneously and all talk to each other. So it's very good for that. It does have a bit of a learning curve. And running the meetings is non-trivial, but participating in them is simple, as you all obviously noticed. Then on the right is the third product that we like, which is called the Amazon Echo Show that you buy from Amazon. And the thing that's really good about it is that it's a standalone little box. You don't have to use your computer or anything, but you do have to buy this product, which, by the way, I have no financial interest in any of these products. So you have to have one of these products at one end, preferably the end of the person who has a little bit of difficulty with technology. This is the solution we recommend for people who are kind of challenged with tech. And the reason is that once it's set up, all the user has to do is say something like call John or call Mabel. And so long as it's been set up correctly with those people's contact details in the product, it will immediately initiate a very nice, clear video call with that person. And the person at the other end doesn't need to have the exact same product. They can use their smartphone, for example. So it's good for the sort of less tech sophisticated sort of people. There's a lot to talk about today, so I'm going to stop my bit there, but feel free to add some questions. I think we're meant to be saving them to the end. And here's some links if you want to check out more of this stuff. Thank you.
And to kind of expand upon regarding some of the video options, and I have a list here: Facebook Messenger, FaceTime, Google Duo, Google Hangouts, Skype, WhatsApp, and Zoom. And as Richard had said, his recommendations, I would agree with them in terms of the three categories that he set aside. But in the event that you don't have an Apple computer or an Apple iOS device like an iPhone or an iPad, these are really good alternatives as well, and they all have their own kind of pluses and minuses. Obviously, some of them require you having a specific kind of an account. Like, for example, to use Facebook Messenger, you would have to have a Facebook account. To use Google Duo or Google Hangouts, you have to have a Google account. But they all, to one degree or another, do similar things in allowing you to make a audio-video call. And what's nice about most of them is that they can also adapt to the varying kinds of network bandwidth that we've been encountering. And when I say network bandwidth, I'm referring to the amount of data that your computers or your phones can kind of push through the, either wirelessly or through their cables into the network. Sometimes when you're using something that uses video and audio, it can kind of slow things down. And so these all have ways that they can kind of adapt to varying network environments. But you can also turn off the video. If you're having trouble with your video, it's stuttering or freezing, you can always stop your video and let the audio continue. And I mention this because in a lot of, like, for example, like nursing facility type of arrangements, the amount of bandwidth that is being shared. The amount of bandwidth is being shared, and so obviously, if you have multiple people using this in the same place, it might kind of slow you guys down.
I was just sorry, jump in and ask questions because we have some questions coming in,
Sure.
and I want to encourage people to participate. So one comment is, a woman says that her husband's care center uses Google Duo because she has an Android and they use an Apple. So it sounds like Google Duo, while you may need maybe like a Gmail account, you can still use it across Android or an Apple products.
Yes, that's true. And so in saying that, I should probably say that Facebook Messenger is available on, like Windows, Mac, iPhone, iOS. FaceTime is unfortunately only on Apple products. And as you just said, Sarah, Google Duo, Google Hangouts are available on multiple platforms: Mac, Windows, Android, iOS. Same thing with Skype, same thing with WhatsApp and Zoom as well. And so, in many cases, different operating systems and different devices can use similar services. And, that's kind of the beauty of it, because we don't all own the same kind of technology.
So it sounds like FaceTime and Google Duo might be better and easier for like one-on-one kind of calls, and Google Hangouts, Skype,
Exactly.
WhatsApp, Zoom, those are, or WhatsApp might also be for one-on-one, and then some of these other.
That is very similar to what Richard said as well. That there are certain services and devices that are better served for different types of meetings, either be one-on-one or a group, or and so, yeah, consider all these things when you're thinking about using these kinds of services and devices. What's going to work for you on your platform of choice? How is it going to work on the other end? Ease of use and things of that nature.
Someone had a question about the strengths of WhatsApp, and I'm not sure if you're familiar with that. I understand, I think it's used a lot internationally. So some people in the States might not be using it as much, but maybe people who are making calls to family members.
That's correct. WhatsApp is heavily used outside of the U.S. It's starting to gain a lot of acceptance here. So it's yet another great way to stay in touch with folks. Another one that's not on this list is Viber, V-I-B-E-R, I believe. Similar capabilities, and again, it's something that kind of was developed, gained acceptance outside the U.S. and is outside the United States, and is starting to get popular here as well.
There's a list. One more question about content we've already covered, from a woman asking, what makes password managers safer from hackers obtaining all of my passwords if the password manager system is compromised?
Sure. No, that's a great question. Well, first of all your passwords are encrypted when they're stored by the service provider. But when you go to unlock your passwords, what you can do is set up two-factor authentication. In other words, use an app on your phone to provide a secondary method of identifying you.
You do that through the password manager?
No, that's done on your phone. You can link a two-factor authentication app to those kinds of services. And then when you go to log in, you'll get a little pop-up notice on your phone saying, hey, somebody's trying to access your phone. Is that really you? I mean, the messages vary, but it's typically just done to authenticate that you are who you are and that you are the person that was asking for access to that.
So I don't think we included information about that in the resources, but maybe we can add that to what we upload on the website for those questions about that. Okay, I think we've caught up. For the rest of them, we'll catch up with as we go. Thank you.
Sure.
Can I just add one comment on all that?
Please.
Of course.
You know, if you just go back to that slide with all those different options on it, I think there's an extra perspective just to layer onto this, because I totally agree they're all perfectly good options in some ways. But I think that, you know, in my mind, there's two types of people right now. There's people who already use all this stuff and they have their own preference and, you know, whatever, right? This is not for them, I guess. And then there's people who've never used this stuff before and suddenly decide they want to, which I think is kind of the interesting audience to try and help. So I actually think that a huge aspect of all this is which ones are easiest to use for someone who's never used any of these things before. So that's the lens I see it through. And that was kind of what came into my suggestion of why we liked 3 particularly. Some of these other ones you've mentioned here, my own opinion is they're not so simple to use if someone's tech challenged. So that's worth bearing in mind.
Oh, and I completely agree with you. And, you know, as many other things in this world, I mean, there isn't a kind of a one size fits all kind of solution. And so different solutions work in, you know, better in different environments and with different kinds of people. I couldn't agree with you anymore. And while we can recommend these things, I mean, often it comes down to what somebody personally prefers or finds easy to use. And, you know, we're all kind of different. So it's worth just trying a few things out, you know, see what works best, really. The next kind of device that may be useful in these kinds of instances are video calling devices, such as the Amazon Alexa Show, the Facebook Portal, GrandPads. They're really interesting tablets that are designed to be more user-friendly in terms of the button sizes, and it's just an easier user interface for, you know, folks to use. During my research for this, I also found the Connect Dementia phone. This is a company from Australia, and these devices kind of caught my attention. They also feature a really easy to use user interface, and they're made, or their designers, you know, claim that this is meant for people who are cognitively impaired. I don't know much about that device, but it struck me as very interesting. And then I also found the Oscar Family. It's a caregiving app, so it could run on any device like a tablet or a smartphone, Apple or Android, but it can help you to provide care for your families. I don't know a great detail. I don't know about this product in great detail, so you might want to kind of check this out on your own. These were just kind of things that I came up with. What's great about these devices is their, generally speaking, is their ease of use, and they just work. You know, you turn them on and it'll work once they're, you know, slightly configured. And of course, the companies that sell these have lots of resources for you to, you know, help you, you know, configure things and to kind of help you set things up. I was particularly interested in the Amazon Alexa Show, and Richard pointed it out. It had some great features. So, you know, the thing about Facebook Portal, it kind of puts you in the Facebook eco, you know, sphere. You're kind of in Facebook, whereas the others allow you to kind of step out and do other things and access other services. So these are kind of good devices to have around.
I'm gonna make a couple of comments. One, Richard also mentioned the Amazon Alexa Show. We have families who have used it where the person really cannot be consistent to make calls or even answer calls. And the Amazon Alexa Show can be set up to make drop-in calls where the person doesn't have to answer, but you can initiate a video call from your end and it's sort of automatically accepted, which has been a way that people have been in to connect with people without requiring them to answer. There's a comment in the chat about the Marco Polo app, and I believe that's an app where you can make video recordings, but I haven't used it myself, so maybe the person can add more details. So some of our clients or loved ones may forget the conversation and go back and listen. So it sounds like a way that you can send possibly audio and maybe audio and video messages that people can go back to, which does sound like it could be useful for people who you might not be able to connect with them at the right time.
That actually brings up something that my wife has been doing. My wife is a kindergarten and first grade teacher, and she's been teaching her students remotely. And she's been using Zoom to record her messages to her kids and then basically uploads them to Google Classroom. So kind of a time-shifted video message to somebody could be really great too. You know, I mean, it's just yet another way to reach out to somebody and just tell them, you know, how much you care about them and how much they mean to you. So yeah, I mean, any and all sources and any and all ways to do this, I think is really, you know, whatever works for you, I think is really the best thing, and what works for the cognitively impaired person as well. And then we also have a category of remote control entertainment, and this is kind of, there's differing degrees of remote control here. So Amazon Fire Stick TV, I'm afraid I just don't know a whole lot about that. Sarah or Richard, do you know anything about this device that you could maybe, you know, chime in on?
I know that it can be set up to where it can be controlled by someone's smartphone. So if you are in a different room or even at a different house, or I think you can use Alexa also remotely to control the Fire Stick TV. So if you have Fire Stick TV on your loved one's television in the facility they live in, you can set up the sports channel or whatever, you know, however you can use streaming, whatever streaming service you use, or YouTube you can use on there, and watch something together, or just, you know, make sure that something they like is on the TV, as opposed to, like, maybe if they're distressed by the news, for example.
Thanks. The Android TV, I actually can speak to. I have an Android TV, and it has an app, and I'll talk about this a little more later, called Team Viewer, where you can actually remotely view the screen. I tested it and installed it quickly, and it works. I can just access like the TV screen remotely over the internet from anywhere. It's a little rough around the edges, but it's kind of intriguing. Some of the other ways to, you know, provide remote entertainment: family photo screensavers. If your loved one has a laptop, or you know, you can create a screensaver with images from your family or from, you know, people close to them, and just let it run during the day. It, you know, could be, if I think, of a lot of help to them. The Google Nest Hub is similar to other devices and that we've talked about, in particular the Amazon Alexa like tablet-like device, but it has a lot of other features too. It's probably worth looking at, and I have a couple of Nest devices in my home, and they're great. I mean, however, the one thing you want to, you know, make sure that you have a good grasp on is when you're deploying these devices, and these are what's called Internet of Things, and they're they're basically non-computer-like devices that are sitting on your network. You want to make sure that you secure them as well. There's a lot of material on that on the internet. If you're concerned about that, just Google, like Google Nest security, and you'll probably find out more than you really want to know.
Andrew, are you talking about using the Nest Hub for video, or as like an Alexa to control an Amazon Fire Stick TV, or so to control remote devices, or as a way to video monitor?
Both.
Okay.
Mm-hmm.
There are a lot of, I just want to acknowledge there's a lot of privacy issues around using nanny cam type devices. I think they're often used by family, and sometimes can be really helpful. I think it's a decision people have to make on a personalized basis. And in facilities, I don't think, I don't think there are necessarily laws against it, but certainly,
well, certainly anything with a camera and a microphone, could be a source of concern. And so it's like many other things, technology-related things, it's about, you're going to have to make some decisions, what's important to you, and also making sure that that device remains secure. Like I said, there's a fair amount of guidance out there, and these devices are all configurable, so you can make them a little more secure than they are straight out of the box.
I just wanted to also add a comment from Nancy that she uses a Fire Stick, and she's clarifying that they're paired with TVs. So it's something that you plug into a smart TV. Thank you for clarifying that. And then you can download apps and stream shows. Mm-hmm. So you don't have to have cable or satellite. You just have to have a Fire Stick and internet.
That's the same thing with Android TV as well. I recently discovered the Netflix Party browser extension. It allows you to watch Netflix. This is a Google Chrome web browser extension. It's an add-in that you can plug into the browser, and it allows you to have kind of like a movie watching party where you can communicate with the other person via chat. And I realize that this may or may not be an appropriate solution for some folks, but I think it's a great way to kind of remain engaged with your family and just kind of watch TV together or movies. Kind of fun. Slingbox is a good device as well. They can record and stream live video. They are remote controllable, from what I understand. I didn't dive too much into that, but they do have apps where you can remote control a Slingbox device. And the final product, the ViewClick Smart Frame, it's basically an internet-connected tablet that is a picture frame, and you can upload pictures from a remote location from your home, and your loved ones will see that on that little picture frame. It's kind of a cool little device. It's not very useful beyond that, but it doesn't have as much purpose or usefulness as some of the other devices on this slide, but it could certainly be a great way to kind of stay in touch with them.
So somebody mentioned the Ring, and another person mentioned CastGG or 27.xyz. I think these are also things where you can do interactive things like watch TV together or play video games together. And I wonder, because this feels like it's getting beyond my technical savviness, if this is something where it would be useful to do a little bit more investigating, or in the way that Richard's group has, to really find out what is the easiest for people to use, and perhaps the most useful for caregivers and people with cognitive impairment. Are you familiar with the Ring? I don't know if he's talking about the smart doorbell, or if there's something else that I'm not familiar with.
The only Ring device I know are those smart doorbells, but I'm sorry I didn't run into anything like that during my research. But just illustrates that there are lots of these sorts of devices out there, and services and apps. And again, it's what works for you and what works for the cognitively impaired folks. I think it largely depends on their level of cognition and other factors. So it's really hard. Again, there's no like single, there's no one fit solution here.
I do know one family used Ring or the smart doorbell to monitor whether their loved one was leaving the house. They didn't want to have a nanny cam in the house. They wanted to be the least invasive possible, and that was the way that they could be alerted if they were leaving the house. This was someone who was not safe to leave the house alone. So
that's a great idea. Yeah, I mean, similar Google Nest devices have similar services as well. So yeah.
Oh, and someone else said they have a client where the caregiver attached the doorbell to his wife's walker so that he can see when she's moving around. That's interesting.
Wow.
Yeah, so if she's at risk for falling or something.
I love hearing those types of stories where people adapt things to that. That's great. I love that kind of stuff. And one thing my father did, he had a Google Nest speaker device, and he would just constantly ask it what time it is, and it made him feel a lot more comfortable being around the house. That somebody could tell him, what time is it, what day is it. It actually added a lot. I never thought much about that, but it really let him be a little more independent. And then the other thing, and I alluded to this in the previous slide about TeamViewer, computer remote control software is in wide use right now. You can install software on a computer and install that same software on another computer, and over the internet you can control those computers. And Google Remote Desktop, Splashtop, and TeamViewer are all either free or kind of freemium services. In other words, there's like a free level of service and there's a pay-for service. I've used Google Remote Desktop and TeamViewer extensively, and that's how I provided remote support for my father's computer. I also have an elderly mother and aunt, and during this the COVID-19 shelter in place, I've been using TeamViewer extensively to provide computer support to them. I even helped my mom do her taxes on TeamViewer. So, you can do a lot here. And like I said about TeamViewer in the previous slide, Android TV is compatible with it. So you could, in theory, if you'll notice in the bottom right of the slide, that's a screenshot of the Android TV. If you connect to an Android TV with TeamViewer, that's exactly what you're going to see. You're going to see what the other person sees. You can guide them through things. You can't watch things with them. That's kind of odd, and I suspect it's something to do with some legalese things. So yeah, I mean, technology, it's helpful to people, but there's not one thing that's going to work, and it's just a matter of finding the right things that work for you. I think Richard's recommendations were great for some of those devices, but if you don't fit into some of the other groups, you can find things that'll work for you, and sometimes you can even kind of put services or devices together and use them in conjunction with one another. So there's a lot you can do. Sarah, do you want to cover this?
As someone mentioned, obviously most of us have phones, and sometimes that's the best option. We've talked to some families that have been sending loved ones letters. One caregiver sent little pop-up books that his wife really liked. Some people have been able to visit loved ones who are in facilities, visiting through their window if they're on a lower level, or even some facilities are allowing people to come outside and sit in an outside area and practice social distancing while visiting. So working with the facility staff to find ways that you can do things. I thought this was really cute. Some people like stuffed animals or robot pets. We had one person who really liked the repeat parrot and would talk to the repeat parrot. But this caregiver, you might have seen this on Facebook, this kind of went viral, but having a picture.
Hello.
I got you a present.
Hey,
I got you a present.
what's that, darling? Ha! Oh!
I don't know what happened to the audio, but basically they took a photo that he was sleeping with every night of his wife and had it put on a pillow. So just
You'll see it in just a second.
Yeah. You can go to the next slide if you.
Hello.
Oh, sorry.
Yeah, so what we've heard from a lot of families is it can be tricky to figure out when is the best time to call someone, and these calls often have to be facilitated by staff. One family member found that calling at a mealtime was good because someone was already in the room helping her mom eat. Other people have found that facilities are designating one person, whether it's the social worker or the activities coordinator, to be the person who facilitates these calls. And then, if you are doing a video call with someone with cognitive impairment and who's older, you want to think about what is the lighting? Are they going to be able to see you, or are you going to be all in shadow? Is the background really distracting? Is there color contrast? And then just making sure that there's not a lot of background noise. And then if you're not using something like the Amazon Show where it's kind of already props itself up, then consider using a stand to help have their phone in place so you can maintain the video.
Also, I've found using a headset, an audio headset with a microphone and speaker, to improve the quality of audio that I'm outputting. So in other words, when you wear a headset, you're probably going to sound a little bit better than if not. Typically, people are sitting about 18 to about 36 inches from their computers, and those microphones and speakers will only reach so far effectively. So another way to just make yourself sound a little better is to use a headset. They're fairly inexpensive too.
So
Can I just jump in there, Sarah? I wanted to add something. Would that be all right? Yeah. So I think it's really interesting, these pictures you're showing and all these comments about the staff needing to be involved. Presumably this is, the idea is when a person is living in a facility, right? Mm-hmm. There's nothing wrong with that, of course, but just think how limiting that is. You now have to fit in with everybody else's schedule. I think that's where the huge benefit comes from something like a standalone product, like the Echo Show, or I guess the Facebook portal is similar. I think the idea that it can be in the person's room and there doesn't need to be any involvement of the staff, especially if you use the drop-in, just puts it in a completely different category.
I agree.
I completely agree.
I think especially if this stay in place and not being able to visit lasts longer, that more people will adopt these kinds of technology. I just wanted to add what some of the comments are coming in. Someone else was saying they use the Ring camera to monitor her husband when he goes to bed early so that she can see. So it sounds like it's kind of like a baby monitor. A lot of people will use a video baby monitor for the same purpose, so it alerts her when he gets up and needs to go to the bathroom so she can make sure he doesn't fall. So I want to move on because I want to make sure we have time for Matthew to present. I think I have one more slide, and this is just tips for facilitating video calls. I think we don't need to cover this. So let's go to Matt's content, and if other questions come up about how to engage someone, I can answer those. So go ahead, Matt.
Good afternoon, everyone. My name is Matthew, and my wife and we've been taking care of my mother-in-law for over 8 years now. She suffers from advanced dementia and has progressed to the point where she cannot feed herself, providing self-care, get in and out of bed. Most of her body has atrophied. Currently, she's staying at a nursing home for the past. She's been there for the past few years, and we've been heavily involved with her care, or the overall care. We've been taking her out on weekly outings. whether it be myself or my wife or a family member or a friend, well, we would make sure that someone was visiting her daily on a daily basis, helping with not just with her overall, just whatever she needs, but and comfort, her comfort, but also with her feeding because she's unable to feed herself. So given the quarantine, which basically barred any family visitation, needless to say, it was a pretty drastic change and definitely a struggle for our family to just kind of to ensure that our mom has everything she needs. Unfortunately, we were able to form a lot of good relationships prior to the quarantine with the social workers and the CNA and nurses and the entire staff, so they know us very well, and that's certainly helped to kind of make this time a lot easier. So some of the things that we were doing in terms of staying connected is we would have scheduled FaceTimes. We would email and even drop off pictures and video. We would schedule seeing her through basically the glass window through the nursing home front door, and just so we can have some type of closer interaction outside of just through the phone or through a screen. We would call every day, sometimes multiple times a day, to see how she's doing, to see how much she ate, and to check out her overall demeanor. A lot of times they change out a lot of the CNAs and staff or the nurses, and a lot of times they don't know her. And when we were able to visit her, we were able to provide some type of supervision with that. But unfortunately now it has to be all done remotely. So we also take advantage of the quarterly care meetings. We actually do have one coming up. And as one of Sarah's slides mentioned, we also will try to find the best time to call. We know that the entire staff is incredibly busy, especially now. And we try to work around, just try not to be too much of a burden, since we are definitely calling a lot more nowadays, whereas before we would just pop in and out and just to see how our mom is doing. Some of the other things that we've been doing is to try to show some appreciation and just kind of raise the morale of the nursing staff and the CNAs. We would just drop off, boxes of donuts, pizzas, just kind of random thank you cards, thank you notes, just to thank them and their staff for all their hard work. And we would also ask ask them in terms of how they're doing in terms of some of their PPEs. As you know, there's a great shortage on masks, and we've kind of gone on our way to purchase quite a number of masks. We probably spent about $1,000 so far on masks to donate to the nursing home. So things like that, whatever we could do to try to help out to ensure that the staff and everyone at the nursing facility can stay healthy and safe, which will also translate into helping our loved ones stay safe as well. So that's just some of the things that we've been doing, and yeah, it's we also found out that since they cut down the staff, or they cut down on essential workers, one of which is their activities director, which is unfortunate. So there's a lot less interaction and a lot less activities for the patients there. So things like FaceTime, things like even our weekly phone calls to try to interact. We would try to have our 3-year-old son pop in on the the FaceTime calls to kind of cheer up, and yeah, all of that is just invaluable. So some of the information earlier from Andrew and Richard were great in terms of the Echo and the Fire Stick and things like that. Just a quick note though, for those type of things, I would assume that we would, of course, need some type of coordination with the nursing home, with their IT staff, to set all of that up. And I do believe that anything with a microphone or a camera will probably be they probably wouldn't allow that. So, but there are versions of the Echo where there is no camera attached to it. So that's something that's we're probably going to be exploring in the near future.
I do know families that have their loved ones have an Echo show and they live in a facility, but I don't know if different facilities might have different policies around that. But I love what you guys have been doing, and I love also that you're really supporting the staff, because I think when staff feel supported, they probably provide better care. So I think it's a good approach all around. I'm curious because your mom is in a more advanced stage of dementia, and I'm curious how she's able to engage with these video calls. If she is, are you actually having conversations, or how are you guys communicating?
Well, like I mentioned, it was through FaceTime. It's basically through the social worker's her own personal phone. Apparently, at least for this particular nursing home, do not provide. The patients do not have their own devices, so it's basically a CNA or someone walking around to each patient, calling a family member and providing that connection. Yeah, our mother is quite, her dementia is quite advanced, so really her interaction is more emotional level. She can hear the familiar sounds and see the familiar faces, and she's just, thankfully she's still smiling and still so that even though she cannot really verbally respond, I mean she does a little bit, but every little bit helps.
Yeah, so you're having somewhat brief interactions, but you feel like you're getting a strong connection, even though it's brief.
Right. I mean, it's really just. The FaceTime calls are about 5 minutes. We have it scheduled once a week, and then then we have the daily phone calls, which is just over the phone. So that's just audio. So we try to get to just talk to her a little bit, reassure her, perhaps say a little prayer with her, just to let her know that we're close by, even though we can't be physically close.
Mm-hmm.
To interact with her.
And there was a comment. There's the one woman is in Utah, and they have a camera device in her uncle's room in that state, and it looks like there was legislation passed. So the Department of Health, or whatever the licensing division is, yeah, we've definitely had people who've had cameras in rooms. I think that it can be a source of conflict if it's. I think facilities will be more open to it if the point is to connect with someone socially, and if the point is to maybe monitor the care, and that might create more conflict with the facility. But I want to open it up with questions. We have about 5 more minutes, and we have great resources here for any questions, or if participants have comments about ways that they've been using. I learned about Marco Polo, and there was one other device. Oh, the Ring. People have been using the Ring in really ways that I hadn't thought about. So if other people have technology that they're using, we'd love to hear about it. And Andrew, maybe you can advance the slide as well. Oh, one more. I had a question, and maybe this goes to Andrew and Richard Caro. So we will post the slides, by the way, on our website as a PDF, and also the recording of this presentation and a summary that includes all the links. So if people want to know if the links will be available, they'll be available on the website. So in terms of, I find myself, I know a limited amount of technology, and it's mainly what I'm forced to know about for work. I'm not a technophile, as they call people, but I'm using it a lot more. Maybe you can go to the Q&A slide, actually, Andrew. I'm using it a lot more, and I wonder if there are other people. I certainly have people in my family that aren't comfortable with technology and are kind of in a position, maybe one might say forced, or they're motivated at this point, as Richard mentioned. So I wonder if we can go back. We've talked about a lot of different devices. Where do you recommend starting, and who are the what are the resources if people have questions? And also, what's the mindset? I think we can get intimidated when we hear about Zoom bombing or different, privacy and whatever kinds of risks. So what's the sort of mindset that helps when approaching new technology?
Richard, would you like to go first? Or?
Sure. It's a rather general question, isn't it? But I think that, again, you have to decide who you're talking about, right? Are you talking about the caregiver or the person with cognitive issues, or what? I think that what I've noticed is that this is a very broad observation, but I think it's extremely relevant. I've noticed that if you just start talking about technology, no one's interested at all, frankly. So what? We could have all this tech, but what's it good for, right? I think if you start talking about what it can accomplish, such as it can let you have much closer interactions with your family member who isn't allowed into the facility anymore, like Matt was talking about, then I think suddenly people are more interested. And so what I've really noticed is that everybody I've interacted with over the last few years flips completely between no interest at all to super interested and super motivated the minute they understand there's something they care about that it will let them accomplish. And so for some people, there isn't anything they need tech for and they're not interested in it. At the moment, what's different is that there are lots of people who in the past would just go down to their coffee shop or go visit their mother or whatever. They can't do that now. So they've suddenly gone from not motivated to motivated because they realize that perhaps some bit of tech could let them change from not accomplishing something they really care about to accomplishing it. So it's really about focusing on the objective rather than on the technology. And I think we often lose that.
That's a good point. And I also think that this was helpful for me in terms of learning what the possibilities are. I think seeing how other people are using tech really gives me more ideas that I'm actually more interested in. So I'm curious, like, if I wanted to try something and I didn't feel confident, or I started having trouble with it and needed help figuring it out, let's say, I don't have someone who's a real tech whiz that's willing to help me. Where do I go for that kind of support?
Who are you? Are you, or are you a 90-year-old with dementia?
Yeah, like, for example, I was talking to a caregiver who used to go to, I think it was a senior center in Berkeley that had a tech support hour that was in person, and that's no longer available. So, but that was where she would go if she was having technical problems. So I'm curious, are there remote options? I noticed that the Osher Lifelong Learning Center used to teach computer basics, but or is it just best to call Amazon tech support? Or I was interested in Andrew's website TeamView, where you can have, if you do have someone in your family, they can remote control your computer and help with that. But
yeah, a lot of those things need you to have set them up in the past. That's the trouble.
Exactly.
But if you've done that, then there's not a problem because you already thought about it. But if you haven't done it yet, I mean, there've always been lots of kind of lectures and courses and things at senior centers and other places. And a lot of those are trying to go online now. I'm not sure they solve the problem you're posing at all, though, myself, because if you're stuck on something, sitting through a lecture probably won't unstick you. And there's also a whole cadre of people that, provide tech support for a fee. And some of those are now trying to do it remotely. there's a category of person who wants hands-on tech support without having to pay for it. That's pretty hard to solve at the moment, I think.
Okay. Well, if anybody knows of any resources, please email me and we will add that to our, maybe it'll become more available in the future. And we're at time. I'm really grateful for everybody's participation. And also thank you to our speakers. I'm so glad that you gave this presentation and not me. I'm much more qualified. So join us next week. Next week's topic is caregiver well-being and how to, you know, care for ourselves during this pandemic. So thank you very much, everybody.
Thank you.
Thanks a lot.
Thank you.